So thanks for joining us. Today we're sharing the results of our report, Gender Diverse, a spotlight on the health of trans and non-binary young people in BC. This was a collaboration between the McCreary Centre Society and the Stigma and Resilience Among Vulnerable Youth Centre, or SARAVIC, who operate out of UBC. And you can download the full report from either McCreary or SARAVIC's website. We're just going to go through kind of very quickly. We're about 25 minutes worth of material, so there's a lot more in the report if you're interested. But before we begin, we just want to kind of humbly acknowledge with real sincere gratitude that both McCreary and SARAVIC are located on the traditional unceded lands of the Coast Salish people, including the Musqueam, Squamish and Tsleil-Waututh nations. And the data for this report came from young people living and attending schools on the traditional unceded lands of First Nations people throughout the region known as BC, and we're so kind of grateful to them for participating, and also acknowledge the Métis people who've been stewards of this land for so long. So in this webinar, we're going to offer a brief snapshot of the report, mostly the key highlights, in order to ensure that we have time for discussion and to answer questions at the end. Elizabeth will just very briefly kind of go through the different sections of the report. So she's going to start by describing how we were able to identify trans, non-binary and questioning young people among the 38,000 youth aged 12 to 19 who completed the 2018 BC Adolescent Health Survey. Share a bit about who they are, then get into some of the key risks to healthy development, aspects of the physical, mental and sexual health, the context in young people's lives that support healthy development, and then finishing off with the protective factors that are linked to better health outcomes in spite of health risks, such as discrimination and violence. And then at that point, we'll open the floor to questions and comments. But if you do have a question or a comment as we move through, please feel free to type in the chat box. So just to give a bit of background, the BC Adolescent Health Survey is a survey of young people in grades 7 through 12 in public schools across the whole province. It's been on every 5 years since 1992. And in the most recent survey, which was 2018, more than 38,000 young people in 58 of the 60 school districts completed a survey. So prior to 2018, the question about gender was limited to the binary options of male and female, and there hadn't been a validated and reliable measure for adolescents as young as age 12 who we're surveying. But based on recommendations from research conducted by Elizabeth and SARAVIC, and on research with adults by Stats Canada, we piloted 2 questions with about 800 young people, and then we used them on the 2018 survey. And you can see that the 2 questions on the screen there: what gender were you at birth, even if you're not that gender today, and what's your current gender identity? Combining these 2 questions allows us to kind of identify cisgender girls and boys, so those whose gender assigned at birth and current gender identity are the same; trans girls whose gender assigned at birth was male and their current identity is female; trans boys whose gender assigned at birth was female and their current identity is male; and non-binary youth who don't identify as males and females, and then questioning young people, so those who are not yet sure of their gender identity yet. So this report that we're talking about today is mostly focused on the nearly 1,000 young people in the 4 gender diverse groups, because the experience of the large majority of cisgender young people are described in the first 2018 BC AHS highlights report, Balance and Connection. In some sections of the presentation, we are comparing cisgender youth and the gender diverse groups, or we note where there are no differences between cisgender and gender diverse youth. And we should also note that most of the time, the slight differences in percentages that we see for the various gender diverse groups are not statistically different from each other. So I'm going to hand over to Elizabeth now, who's going to go through all the results.
Thanks, Annie. And we'll first start with actually describing who are the gender diverse youth in the BC Adolescent Health Survey. So as Annie said, there were nearly 1,000 or 2.5% of the 38,000 young people who participated in the BC Adolescent Health Survey who were gender diverse. And they represent nearly 6,300 young people in mainstream schools across BC. The average age of participants in the survey was 15 years old, and that actually wasn't different between any of the gender groups, including the cisgender group. Around 1 in 10 lived in rural areas, and a smaller number of trans girls and questioning youth were born in Canada compared to non-binary and trans boys, and nearly half of gender diverse youth spoke a language other than English at home. Risks to healthy development in their environments is one area where many of our analyses compare gender diverse youth to cisgender youth, and overall, gender diverse youth were more likely to experience these challenges, which might in turn explain some of the health disparities that they experience. So we'll cover a few of the key issues in the next section. Unstable living situations can create health challenges for young people, and we found that gender diverse youth were twice as likely to report running away from home and being kicked out than cisgender boys and girls. They were also more likely than cisgender youth to report limited access to resources, such as clothes that allowed them to fit in, transportation, spending money, money for lunch, and fees for extracurricular activities, although they were similar to cisgender youth in having a smartphone or access to the internet. And while about 1% of cis girls and boys reported often or always going to bed hungry, trans girls and trans boys were 6 to 8 times as likely, and non-binary and questioning youth were 2.5 to 5 times as likely as cisgender youth to go to bed hungry often or always. Violence and discrimination are an area where gender diverse youth consistently reported higher rates than cisgender boys, but not always compared to cisgender girls. For example, fewer than half of cisgender boys reported experiencing any form of bullying, while a majority of cis girls, trans girls, and questioning youth reported bullying, and an even higher percentage of trans boys and non-binary young people reported experiencing any form of bullying. Gender diverse youth were also more likely to report being cyberbullied and experiencing verbal and physical sexual harassment, as well as physical and sexual abuse than cisgender boys, but not always higher than cisgender girls. One area that did not consistently follow this pattern was physical assaults at school. Cisgender girls actually reported the lowest rate of physical assault of any group at 6%, while about 1 in 10 trans and cis boys reported being physically assaulted in the past year, and around 1 in 5 trans girls, non-binary, and questioning youth had been physically assaulted. Trans boys at 79%, non-binary youth at 66%, and questioning youth at 59% were more likely to have experienced any form of discrimination in the past year compared to cisgender girls at 44%, and were about twice as likely to report any form of discrimination compared to cisgender boys, who only reported 32%. They were also more likely to report higher rates of each individual type of discrimination, except for racial discrimination, where 1 in 10 gender diverse and cisgender youth reported experiencing racism in the past year. Now let's go on to health issues. Youth were asked to describe their overall physical health. This is an important measure of health that's actually predictive of early mortality. About half of each gender group rated their physical health to be good or excellent, and these were not significantly different from each other. On the other hand, the majority of them did not get the recommended 8 hours of sleep last night, and only a third woke up feeling rested. And like their cisgender peers, the majority of gender diverse youth did not meet age-specific recommendations for daily physical activity, with only about 15% of them meeting the guidelines for moderate to vigorous physical activity each day. Gender diverse youth were more likely to report extreme stress than cisgender boys. Trans girls and cis girls were not significantly different from each other, but the other groups were also more likely to report extreme stress compared to cisgender girls. 34% of trans boys, 32% of non-binary youth, 25% of trans girls, and 24% of questioning youth reported they had experienced extreme stress in the past month, compared to only 6% of cisgender boys and 17% of cisgender girls. Previous research has linked bullying and other forms of violence with suicidality, suggesting that up to 75% of suicide attempts might be prevented among adolescents if we could eliminate all forms of violence exposure. When you consider the high rates of discrimination, bullying, and other forms of violence among gender diverse youth in the survey, and the high rates of extreme stress they report, it's not surprising that nearly half of gender diverse young people also reported seriously thinking about suicide in the past year, and almost 1 in 5 reported at least one suicide attempt. In contrast, sexual health and substance use were two health areas where there were few differences between gender groups, including cisgender youth. When it comes to sexual health, gender diverse youth were less likely to use condoms at last sex than cisgender youth, but they had similar rates of ever having sex or of using alcohol or drugs the last time they had sex. And there were similar rates of gender diverse youth and cisgender youth who reported ever trying alcohol, tobacco, vaping, or cannabis, except that there was a slightly higher percent of non-binary youth who smoked tobacco than cisgender youth. Access to healthcare, however, was another area where there were differences between gender diverse and cisgender youth. Although only 6% of cisgender boys and 10% of cis girls said they missed out on needed physical health care in the past year, 1 in 5 gender diverse youth reported missing out on physical health care, and more than half of trans boys and non-binary youth, 44% of questioning youth, and 37% of trans girls reported they had needed mental health services but did not get them. And that was higher than the 1 in 4 cisgender girls and much higher than the 9% of cisgender boys who missed out on needed mental health services. And now we'll turn to focus on aspects of life that support healthy development. Family, friends, school, and community are important sources of safety and support for young people that help them to be healthy and thrive. Although many gender diverse young people felt well connected to their families, friends, school, and community, they didn't experience the same level of support as their cisgender peers. For example, around half of gender diverse youth said their family respects them, but 80% of cisgender boys and 73% of cisgender girls said their family respects them. Similarly, over half of cis girls at 54% and 2/3 of cisgender boys, 67%, felt their family understood them, but only a quarter of trans boys and non-binary youth and about 1/3 of questioning youth and trans girls felt their family understood them. And while most gender diverse young people felt safe in their home often or all the time, 1 in 4 did not. Safe and supportive schools are important for effective learning too, and gender diverse youth reported lower levels of school connectedness and safety than their cisgender counterparts. 54% of trans girls, 45% of trans boys and non-binary youth, and around 55% of questioning youth agreed or strongly agreed that teachers at their school care about them, but only about 1 in 3 felt other school staff cared about them. Nearly 2/3 said that staff expected them to do well, but 1/3 of trans, non-binary, and questioning youth felt a part of their school, and just over 1/3 said that they were happy to be at school. Safety was another important issue. While 2/3 of trans girls and non-binary youth and 3/4 of trans boys and questioning youth said they usually or always felt safe in their classroom, and even higher percents felt safe in the library, fewer than half of trans boys reported feeling safe in washrooms and change rooms. And although the rate was slightly over half for the other groups, washrooms and change rooms were also the places that transgender girls, non-binary, and questioning youth felt the least safe. Many young people use public transit to travel to and from school, or to participate in extracurricular activities or access community supports, and to visit their friends. And among those who used public transportation, more than half of gender diverse youth said they rarely or never felt safe on transit. There are some positives about school, though. The majority of young people plan to finish high school and go on to post-secondary education, and estimates were not significantly different from each other. 80% of trans boys, 76% of non-binary youth, 71% of questioning youth, and 68% of trans girls plan to finish high school, and roughly 2 in 3 trans boys, non-binary youth, and questioning youth, and slightly less than that of trans girls also plan to attend post-secondary education, whether that was a trade school, university, or even graduate degrees. The majority of gender diverse youth were involved in extracurricular activities as well, from sports to clubs to the arts. They were more likely than cisgender boys to participate in arts, drama, singing, and music activities. And around 1 in 3 gender diverse youth participated in informal sports such as biking, skateboarding, or similar sports without a coach, at least once a week. Most gender diverse youth had at least one supportive friend, and 2 in 3 reported 3 or more friends. About half had a supportive adult in their neighborhood who cared about them, and about half had a supportive adult in their family that they could turn to if they had problems. Youth were also asked to rate their quality of life. About half of trans boys and non-binary youth and more than half of questioning youth and trans girls agreed or strongly agreed that they have a good life. Similarly, more than half of trans girls and just under of questioning youth, non-binary youth, and 38% of trans boys agreed or strongly agreed that their life was going well. However, just over half of trans boys and trans girls and more than a third of questioning and non-binary youth wished they had a different life. Let's focus further on some of these protective factors and how they interact with health issues. Protective factors are those relationships, supports, activities, and coping skills that help foster healthy development for young people and reduce the odds of poor health outcomes, especially when they face stressors such as stigma, discrimination, and violence. Although we've just shown how common protective factors such as school and family connectedness are lower among gender diverse youth than their cisgender peers, when they have high levels of school connectedness or really caring families, do these protective factors work for them? Gender diverse youth who felt highly connected to their school were more likely to report good or excellent mental health and were less likely to have foregone physical or mental health care or to experience negative consequences of substance use or to have seriously thought about or attempted suicide compared to gender diverse youth who were not connected to school. Likewise, gender diverse youth who reported greater feelings of family connectedness were much less likely to report extreme stress, suicidal thoughts and attempts, or problems with substance use. And youth with high family connectedness were also much more likely to have been able to access physical or mental health care when they needed it. This profile of trans, non-binary, and questioning youth shows they face a number of challenges and have a number of strengths that can support their health and well-being. Compared to their cisgender peers, gender diverse youth face higher rates of discrimination and violence and lower levels of safety and support. As a result, it's not surprising that they experience higher levels of stress and higher risks for self-harm, including suicidal thoughts and attempts. Unfortunately, they were also more likely to miss out on needed physical and mental health care. However, gender diverse youth also have areas where their health and social engagement are similar to cisgender peers, and for the most part, they're similar to each other. For example, the large majority of gender diverse youth plan to complete high school and go on to post-secondary education. Most gender diverse youth report involvement in one or more extracurricular activities, and they're more likely to be engaged in arts, drama, singing, and music activities than cisgender boys. The large majority of gender diverse youth have close in-person friends, and they're more likely to also have online friends than their cisgender peers. They reported similar rates of alcohol, tobacco, and cannabis use as cisgender youth, and they're just as likely to report sexual experience. In sum, the majority of gender diverse young people are doing well, often in spite of the challenges they encounter in their schools and communities. Importantly, key protective factors such as family and school connectedness are also protected for gender diverse youth when they have high levels of support from family, from teachers, and a sense of safety and belonging at school. They're far less likely to report mental health problems, suicidal thoughts and attempts, and more likely to report good or excellent health, happiness, and self-esteem. These responses from trans, non-binary, and questioning young people underscore how we must work to reduce stigma and discrimination and related violence and rejection, what I would call enacted stigma. At the same time, working together to foster safer and more supportive school environments and helping families better understand and support their gender diverse young people, these are likely to benefit them even when they experience stigma and violence from others in the community. Gender diverse young people have ideas about how to create safer and more supportive environments that help them to thrive, and we owe it to them to listen and act on those ideas to improve their health and their futures. Back to you, Annie.
Thanks, Elizabeth. And yeah, that was really just kind of an overview snapshot. So if you want a copy of the report, as Elizabeth said, it's available on our website and also on the Saravik website. You'll also see on the McCreary website the Youth Action Grants. I wanted to bring people's attention to that. These are dead low barrier kind of grants for young people to apply for if they want to do a project that improves the health of gender diverse youth in their community or includes gender diverse youth. In any sense, we've funded a number of kind of projects already that support sexual minority and gender diverse youth, and always looking for applications to fund. So if you're interested in that, the details are on the slide or on our website. Also wanted to bring people's attention to this Taking Pride, which is a partnership between McCreary and Saravik, developing and delivering a healthy relationships series of workshops aimed at LGBTQ plus young people aged 14 to 19 throughout the province. We've been rolling them out in schools across the province over the last few months, as well as in community groups. And we're kind of coming to the end of the school year and finishing quite a few of those off. So we're kind of open and available for groups for any point kind of moving forward. So if you know anybody who might be interested in that, the kind of details are on the screen. You can email McCreary at Katie or either of us, and we can put you in touch if that's of interest. And then the last thing I wanted to draw attention to was another partnership between McCreary and Saravik, which is we're doing a sequel to the Not Yet Equal report, which came out in 2007 and looked at the health of lesbian, gay and bisexual youth back then. We've got updated questions and updated data, quite a lot of it since then. So we're hoping to put that out in August for kind of, and we'll do a series of webinars with that and a recording of that as well, I presume. So that will all be out in August. Just before we open it up to questions, we want to say a sincere thank you to the research team who helped pull this report together. Zainab, who I think is on the call today, who did a massive amount of work on this, as well as Cormac and James, and then Stephanie Hall and Stephanie Martin, who pulled the report together, and Stephanie Hall, who made this beautiful PowerPoint, and then to Alex Vandermar, who created the drawings that we use throughout the report and are on this PowerPoint, and to me just really kind of bring it to life. I think they're beautiful. We want to thank CAHR for funding this, and the biggest thank you goes out to the many gender diverse young people who completed the adolescent health survey, and kind of, you know, indebted to everybody. So there's our contact details if you'd like to get in touch with us. I saw there was a question in the chat box, I think, from earlier, and we'll throw it open to questions as well, if anybody wants to unmute themselves and make a comment or ask a question.
And the question in the Q&A was just a comment about the beautiful art and images. And yes, thanks again to the fabulous artist, Alex, who has drawn all of the images in the report and as part of this slideshow. Any questions or comments from folks? Feel free to raise your hand or put something in the chat.
And if there's no questions now, but you think of one later, or you read the report and kind of have a comment, you'd be welcome to email us.
So we have a question from Michelle. What would your suggestion be to adult allies as a first step around safety for these youth? It's a really good question. I think one of the really important things is to really follow the lead of young people and provide, accept them, follow their guides around pronouns or their discussion or description of their gender, and recognize that sometimes gender presentation does not align with people's gender identity, either because they don't feel safe expressing their gender, but also because there are such a variety of ways to be and do gender, including a lot of gender nonconforming within people's gender identities. And so there are young people who will be very clearly identified as a cisgender boy, but also engage, like have some gender nonconforming choices around hair and clothes and actions. And that doesn't mean they're transgender. It just means they're gender diverse or nonconforming, and they may still be really clear internally about their sense of being a cisgender boy. Whereas for others, that expression of gender really signals a non-binary identity, either encompassing the entire binary or beyond and separate from. People have some really ongoing sort of complexity around understanding gender, and it's growing and evolving in our societies. And so I think, being a safe ally also means keeping confidentiality and not necessarily outing young people to others in the community or to parents before they're ready to actually share that information with others.
There's another question, Elizabeth. Somebody's saying they were struck by the low levels that reported liking school. How does this compare between gender diverse and cisgender participants?
Definitely the cisgender youth reported higher levels of liking school, but and they were significantly different. They were not, however, like hugely different in terms of you're not seeing like 95% of youth like school in cisgender communities. But yeah, there's definitely the questions around liking school are part of our school connectedness measure. And overall, those measures were lower for gender diverse youth than they were for cisgender young people.
And another question, thinking about Pride and creating inclusive events, what extracurricular activities were the most popular for this group of youth?
So most popular were actually arts related ones and volunteering in, like for charitable groups. Sports that weren't with coaches were like the next largest activity, and then clubs. Sports with a coach were a bit lower, and I do wonder if some of that actually is playing out because of the rhetoric in public, or the questions that are being grappled with around where non-binary and transgender youth would be allowed to play on in like sports teams. You hear that, in the Olympics, and in some laws are being passed in the United States, and that creates a sort of chilling rhetoric everywhere. But I also know that in Canada, there are, I think some of the organized, whether that's soccer or rugby or some of the others, are working to create the policies that actually allow folks to participate based on their gender identity as opposed to sex assigned at birth.
I think that's it for questions and comments. Oh, one more.
Nope, that was just a thank you.
Thank you.
All right then. Well, thank you everyone for attending, and do feel free to download the PDF of the full report. This was really just a snapshot of the information that is in the report, and feel free to reach out to Annie or to me or to others at McCreary or Stigma and Resilience Among Vulnerable Youth Center about the research that we're doing.
Thanks for your time, everybody.